Today, we're diving into a really fascinating medical study about Achilles tendon surgery. And here's the twist. The repair that was supposed to be stronger actually led to more failures. Now that sounds totally backwards, right? Well, stick around, because the data tells a really surprising story. So here's the big question we're going to tackle. When a surgeon is fixing a damaged tendon, they have this option to add a reinforcement, it's called a graft, to try and make the repair stronger. You'd think, logically, that a beefed-up repair would be way more durable. But is that what really happens? Let's dig into the evidence. All right, first things first, let's set the stage. Why would anyone even need this surgery in the first place? Well, it all starts with a pretty painful condition that can sideline serious athletes, but also, affect just about anyone. The official name is insertional Achilles tendinopathy, or IAT for short. But basically, it's where the big tendon at the back of your ankle, the Achilles, gets all worn out and inflamed right where it connects to your heel bone. It's a long-term, degenerative thing that causes some serious pain and makes it tough to just get around. And you might think this is just an old person problem, but it's not. Yeah, it definitely affects older adults dealing with that wear and tear over time. But it also hits younger athletes who are constantly putting stress on their bodies. For either group, surgery often becomes the last resort when the usual stuff like rest or physical therapy just isn't cutting it anymore.
Okay, so once a patient decides on surgery, the surgeon has a big choice to make, and the study we're looking at focused on two main ways to do the repair.
So on one side, you've got your standard repair. The surgeon just goes in, cleans up the damaged bits of the tendon, and reattaches the healthy part securely to the heel bone. Pretty straightforward. But then you have the reinforced repair. With this one, they do all that, and they add a graft, basically a little piece of another tendon, to make the connection extra strong. Think of it like this. You patch a hole in your jeans, but then you sew an extra tough piece of canvas over that patch, just to be absolutely sure it's not going anywhere. That's the idea anyway.
And this is where the mystery really begins. The researchers looked at the data and asked, okay, who's actually getting this extra reinforcement? Were the patients who got the graft any different from the ones who didn't?
And boom, right away, we get our first big clue. It turns out the patients who got the graft were, on average, more than 5 years older than the ones who didn't. And in a study like this, that's a really significant difference.
But check this out. This next piece of data is even more dramatic. Look at how long people waited between their injury and the surgery. The group without a graft waited about 3 weeks. But the graft group, they waited almost 2 months. That's nearly 3 times longer. This really suggests their condition was a much more stubborn, long-term problem.
And the clues just keep piling up. The data also showed the graft patients were more likely to have other health problems going on. They were also way more likely to have already tried and failed other treatments, like steroid shots or physical therapy. So the picture that's emerging is crystal clear. These were not two identical groups of patients. The folks getting the graft were, from the start, more complex and challenging cases.
All right, so now we get to the moment of truth, the results. We know the graft group was already facing a tougher battle, so how did they do after getting that stronger surgery?
Well, first, let's start with the really good news here, because on the whole, this study found that both of these surgeries were a huge success for the patients.
I mean, just look at these numbers. They're incredible. For pain, the no-graft group went from a 3.5 all the way down to 0. The graft group had a nearly identical drop. And for function, which is basically a score of how well you can move, both groups just skyrocketed from the low 20s up to 94 out of 100. That is a life-changing improvement. So at first glance, it looks like both surgeries were amazing.
But there's always a but, right? There's another huge measure of success. Did the repair actually last? Did it hold up over time? This is where you'd bet all your money on that stronger, reinforced repair to win. So, how many people had their tendon retear within a year?
And there it is, the big shocker, the punchline of this whole study. The group with the standard, simple repair had a retear rate of almost nothing, 0.18%. But the group with the supposedly stronger, reinforced repair, their retear rate was over 2%. That is more than 10 times higher. So what in the world is going on here?
This is the puzzle, right? How could the stronger fix lead to more breaks? It's time to put all those clues we found earlier together and figure out what this whole thing really means.
The study's own conclusion basically hands us the answer on a silver platter. Remember all that data from before? The graft wasn't just given out randomly, it was used more often in patients who were older and had more health problems. In other words, the exact patients who were probably at a higher risk for complications from the get-go.
And this all boils down to one of the most important rules in science. Correlation does not equal causation. Just because two things happen together, in this case, getting a graft and having a higher retear rate, it doesn't mean one caused the other. The evidence here strongly points to the patient's underlying condition being the real reason for the different outcomes.
So what's the big takeaway from all this? First, this study is absolutely not saying that grafts are bad or that they don't work. What it's showing us is a glimpse into how surgeons think. They're already using these grafts in what they see as the toughest, most chronic cases. And it's those underlying challenges, being older, having the injury for longer, that are the likely culprits behind the higher failure rate, not the graft itself. And, this kind of information is pure gold for doctors and patients, helping them have a more honest conversation about the real pros and cons of their options. And that really leaves us with one last, much bigger question to think about. This whole study is a perfect snapshot of a huge challenge in all of medical research. When we see a result, how can we be sure if it's because of the treatment we're testing or if it's because of the type of patient who got that treatment? It's a massive puzzle that scientists and doctors are constantly trying to piece together.